us any kind of aggressivity. Look who's coming. Oh, he's coming back. Yeah, to mommy. He's fully recovered from anesthetic now.
Hello. So, are you happy with the updates that you've got today?
Absolutely, absolutely. Couldn't ask for more beautiful care.
Oh, thank you. And how did you find us?
I found you through Facebook. Just somebody recommended you on Facebook.
So were you happy with the quote that you were given for buster surgery?
The company that you recommended me to, the finance company, they've been amazing. They've been really supportive and helping us. I've had to ask them a few questions and they've got back to me really quick.
Really promptly.
Reassured me. And
amazing.
Yeah, they've been really good.
And it's 0% interest, so they don't make anything, it's just pay it back as and when you can afford to, which makes things possible.
Yeah, absolutely.
I think you were a bit disheartened when you were first quoted at your original practice, and we're lucky that you've found us.
Support I didn't get, you know, they just wasn't even prepared to meet me halfway or to make any contributions towards the cost. They kept adding things on, like I was told it's going to cost like £50 just every other day, just to have his dressing changed.
Yeah.
And you just go in link mode because you know financially you can't afford it.
No.
And it's your baby.
It puts that pressure and that strain.
Like, well, what am I supposed to do? And like, it's just been horrendous trying to get support and help.
Yeah.
And the minute I rung you, from that moment, you've been my rock. You've been my support. Everything.
Yeah, and we're really
the best place to come.
We're really happy that you found us and that we were able to help him. And ultimately, it's just going to be so much more comfortable.
Yeah. Again, it's not about the money; it's about the animal. You know.
That's
it.
it.
There are people out there that can't afford to pay for vet bills.
No.
Come here because they help you, they support you, and they give you all the talks, all the prices, and they break it all down for you. And you could go away feeling not worried. You could go away feeling less stressed and less worried.
Thank you so much.
That's how
Buster, he has been referred to us with an ongoing chronic issue with one of his digits. Came to us with non-responsive nail bed infection treated. Our concerns was related with developing a neoplastic process there, or to find out if it's about an immune-mediated condition, or maybe it's just a chronic deep infection, either fungal or bacterial, or potentially foreign body in. Our suggestion in diagnostic approach, it was to have a first consult when we've assessed the lymph nodes to see if any reactive lymph nodes in terms of axillary lymph nodes, prescapular lymph nodes, which came back as unreactive. Also, we've assessed the nail bed deformity there, because when we are speaking about any kind of neoplastic process, we are speaking about bone structure degradation, lysis there. Also, the deformity can be given by a soft tissue swelling or a foreign body inflammatory reaction there. We've offered to have X-rays to have a better idea in terms of bone lysis, periostal reaction, also if any kind of soft tissue mass in there, or any kind of radio opaque foreign body in, but has been declined due to the cost. And also we've offered to have a cytology here to reveal us if we are speaking about a deep fungal or bacterial infection, which has two different type of therapeutical approaches.
Preparing the area for surgery now.
what are you doing there then?
So this is just an easy way to make sure that the whole foot is clean for the surgery. It's basically just a glove with some Hibby scrub, it's warm water, and it's just an easier way of kind of cleaning
sure
the
you
foot,
get all
really.
of the-
Yeah, and getting in all the creases. Yeah.
So after clipping and scrubbing the area, we have a better image now. We still are not able to have a proper diagnosis, but on our differential diagnosis list, we can speak about squamous cell carcinoma potentially, eventually melanoma, which is a skin type of tumor. Also can be a lymphoplastic pododermatitis as well. That means a very deep infection which affected all that area. This one is usually immune mediated. Also can be a fungal infection in here, which could give him that type of inflammatory response, and also can be on top of the diagnosis, our diagnosis in terms of differential diagnosis list, because he had antibiotic therapy, which he didn't respond well, and the condition didn't improve with normal antibiotics. So it is possible to be a fungal infection. In terms of treatment, in between a bacterial infection and a fungal infection, when we are speaking about fungal infections, we are speaking about treatment which can last 6 to 12 weeks plus, which means it's a long-term treatment, but should be started after you have cytology done with culture and sensitivity, and to have what are the best drugs to start with. But in his case, the owner take the decision to have a radical approach. That means toe amputation, which will take place from this area, will disarticulate underlying bone, and we will close it back afterwards. We are using our K-laser surgical unit because it's less invasive. It's sealing the blood vessels and lymphatic vessels instantly, and also it helps with the healing process as well. Maybe a bit more slower, but the output is better. Right now, in here, we have contact with bone all around. Now we are searching the joint, and we will disarticulate the bone through the joint. We left that two skin flaps to be able to close the incision, and basically that's it. The toe has been removed, and now we are doing the plan how to close the wound. As far as I can see, we have plenty of skin to close it in here, and probably will use an intradermal technique. Just do not be necessary to touch the area during the healing process, more than keep it clean and dry, with no stitches removal at the end of healing process. We have finished.
Oh, that looks really nice.
Yeah, it's all closed now. We need to scrub the area and bandage the wound. Yeah.
he can be recovered.
Please feel free to call the Noah's Ark team for any type of support that you might need. We have a state-of-the-art facility set in 55 acres. We also have paddocks that clients can use for running their dogs. And due to our historic ability to handle the more powerful working dogs, we specialize in that aspect.